Congressional Democrats are moving farther left, taking up the calls of self-styled Democratic socialist Bernie Sanders to expand Medicare for all. When America's Kara McKinney delves into its potentially harmful effects for everyday Americans.
Momentum is gathering among House Democrats for a single-payer health care system. The Medicare for All Caucus is launching today with 60 founding members, including Minnesota Congressman Keith Ellison, a DNC deputy chairman. As the name implies, the group hopes to expand Medicare to include all Americans by moving away from private plans. Right now, Medicare is only available for people aged 65 years or older or who suffer from qualifying disabilities. This is not the first time the left has sought greater government control over Americans in health care. The Clinton administration attempted to create a universal health care policy back in the early 90s, and the Obama administration passed through the Affordable Care Act almost 2 decades later. Obamacare has since been plagued by rising costs, scandals.
If you are happy with the health care that you've got, then keep it. If you like your doctor, keep it.
The way I put that forward unequivocally ended up not being accurate.
And has left millions uninsured despite lofty promises. Now House Democrats are trying to mirror Vermont Senator Bernie Sanders' actions in the upper chamber, where he introduced Medicare for All legislation last fall. The single-payer system calls for the government to pick up the tab for emergency care, prescription drugs, and some mental health care services. The Urban Institute predicts Sanders' version of Medicare for All could cost more than $30 trillion over the next decade. So the question then becomes, who's going to pay for it?
While, depending on your income, your taxes may go up to pay for this publicly funded program.
Some option supporters have floated include a 4% income tax surcharge on everyday Americans and an almost 8% payroll tax on employers. Republicans also worry the plan could increase wait times and drag down overall efficiency in the healthcare system, problems that can be cured by a competitive marketplace. This sentiment is echoed by Texas Senator Ted Cruz.
When government takes over healthcare, every example on earth, the result is rationing and waiting periods, and you, the citizens, being told, no, you can't have the healthcare you want and deserve.
At this point, a single-payer plan does not have the votes necessary to pass Congress, but the issue does look to be a key player in midterm elections this November. Kara McKinney, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.